Hi, I'm Gracyn Lindborg.
Hi, I'm Jennifer Cruz.
Hi, I'm Zoe Fineberg, and this is Harvey Fineberg and Mary Wilson. Take it away.
Hi. Should we just say who we are then? I'm Harvey Fineberg. I'm now the president at the Gordon and Betty Moore Foundation. And in the past, I was a dean at the Harvard School of Public Health, now called the Harvard Chan School of Public Health, and the president at the Institute of Medicine.
And I'm Mary Wilson. I'm a professor at the University of California, San Francisco, and an adjunct professor at Harvard in global health and population. And I'm an infectious disease physician and have been doing that for a long time.
Teaching me for many years.
Okay, so the topic of today's discussion is going to be how prevention and treatment plans are made for new diseases and viruses. Very relevant today in the world of coronavirus. So, Jennifer, you can ask our first question.
I just want to say thank you for joining our project today. And the first question would be, what components of a disease are looked at when you create a prevention plan and treatment plan?
Well, let's start with prevention. Because prevention for an infectious disease begins with an understanding of how that disease is spread from one person to another. This is part of the field of epidemiology, understanding the cause and nature and distribution of disease. With infections, there are many ways they can go from one person to another. If you have a blood-borne infection or a sexually transmitted disease like HIV/AIDS, your preventive strategy is going to be very different than if you have a respiratory infection like tuberculosis or influenza or the coronavirus SARS-CoV-2 that we're now facing in the COVID-19 pandemic.
Well, I would just add that the interventions could be anything from a vaccine to behavioral and education, like HIV, for example, to using medication. And with HIV today, actually treatment is also prevention, because by taking medications, you reduce the amount of virus so that people are no longer able to spread it to another person.
So prevention in an infection is basically about interrupting the spread from one person to another. But for treatment, as Mary was suggesting, it's sometimes tantamount to the same strategy as prevention, but oftentimes to really treat effectively a disease or an infection, you need also to understand how that infective organism affects the organs of the body, your physiology, your ability to function. Partly that's from the symptoms, partly it's what the clinician will detect on examination, partly it's the way the disease expresses itself in an individual patient's body. So treating the disease could be a treatment aimed directly at the cause, like the infective organism, or it could be aimed at reducing the effect of that organism, even if you're not directly treating the organism.
I was just going to say that in other instances, for infections that are spread, for example, by mosquitoes, if you take malaria, the most basic way to prevent transmission of malaria is to get rid of the mosquitoes or to interrupt the contact that mosquitoes have with people. So there are times when interventions may have to do with providing clean water, sanitation, eliminating the mosquitoes. There can be a broad array of interventions that can prevent the spread of infections.
One of the things I always loved about public health is it invites you to think very broadly and inclusively about what strategy could be effective once you understand the nature of the cause and how that organism behaves. You can then create very effective ways to interrupt its spread and to treat its spread when it occurs.
But it also requires having a lot of information about the basic biology. So often there's a laboratory component to really understand the molecular genetics or the basic physiology before you can really put all of the pieces together.
Yeah, science from the lab, science in the field, science in relating to people and communicating successfully. These are all part of the overall strategy of ensuring a healthier population and stopping the spread of a pandemic.
As you said about like gaining more knowledge about it, what's the difference in the goals of the plans, like short-term versus long-term?
Plans for intervention or plans for learning about the disease?
For intervention.
For intervention. So, for example, let's take a pandemic. In the very near term, you have a crisis. You could have an emergency. You have to be able to first be sure you can treat everyone who's sick. So you may have to ensure that your hospitals, your intensive care, your health professionals have the equipment to protect themselves. So in the very near term, you may have to do some urgent treatment decisions. Also in the very near term, interrupting the spread from person to person in an immediate sense can be very critical. How do you keep people apart when it's a respiratory disease? How do you get everybody to wear a mask when they will help in preventing the spread? How do you encourage all of those practices for everyone in a community? When you look at the longer term, your strategy is also about containing that pandemic over time. That's where vaccines may come in to the picture from a point of view of a preventative. And it's also where deeper understanding of the origin of these emerging diseases can also be a very important part of the long-term strategy of avoiding them in the first place.
I guess I would say that short term, I guess an immediate concern is if it's an infection that can kill people, you want to identify those populations that are at highest risk of dying or having irreversible consequences from the infection, which means that you have to understand something about the epidemiology, who is vulnerable, who is most likely to develop severe consequences. And I think in almost all instances, we really have to think globally. And one of the things we want to know every epidemic or pandemic starts somewhere. But there are some, like Ebola, for example, even though there was a lot of attention in the United States, the risk, in fact, to the United States was extremely low. Take, though, COVID. As soon as we knew how it was spread, we knew that it was going to be a global problem. So very early on, one needs to identify those factors as well.
Okay, so how are the side effects of certain plans considered? Meaning, where is the line drawn?
Side effects of the plans or side effects of the treatments that you give to individual patients?
Of the treatments.
The treatments of patients. Well, if you're thinking about any kind of treatment to an individual patient, you're always trying to balance benefits against possible risks or side effects. So for example, one of the treatments in COVID for patients who are with advanced disease is a treatment with a steroid called dexamethasone. But that same treatment, which is proving to be life-saving for severely ill patients, would actually not be useful and might, in fact, increase the harm if it's used too early in the case of the disease. And the opposite is true for some other kinds of treatment. So you're always weighing in an individual patient the trade-off between what is optimal in benefit to risk for them right now at the stage of disease that they are.
Well, there also are instances where with HIV, fairly early on, we knew that was spread by blood transfusions. But blood transfusions are life-saving in many individuals. And so you need to have a blood supply, but you also need to have it be safe. And so when are you infringing on rights of people to donate or to have blood available? So that there often are a lot of competing kinds of information. And one issue that frequently comes up is that if a medication or a drug becomes available that might help, there's often an impulse to want to just try it, just use it if someone is desperately ill. But I think one of the things we are learning again and again is that it really is essential to do research during a pandemic, which means we have to be prepared for pandemics and epidemics in advance so that while it is unfolding, we can also do the solid scientific research that will be necessary part way through to say, we know this works and this doesn't work, and we can then treat more effectively.
A great example of what Mary's talking about was the use of convalescent plasma to treat patients with COVID infection. It is possible that it still might be helpful for some patients at a certain stage of illness, but most of the evidence, which is accumulating in real time from research on patients who are being treated, shows that convalescent plasma is not helping to shorten disease or improve the condition of most patients. So that is a really important insight.